everyone. This week I am bringing to you Carrie Silvernail. Carrie is a part of the Alliance for Benzodiazepine Best Practices, along with her husband, Bernie, who we interviewed earlier. She suffered a benzodiazepine injury after it was prescribed for pain and anxiety. Carrie graduated with a Bachelor of Science degree in nursing from Oregon Health Sciences University. She began her career as a research nurse at the university and eventually moved to years as a maternal child nurse and lactation consultant in clinical and public health practices. She eventually left her job to focus on healing from the benzodiazepine injury. Her greatest pride is the raising of two wonderful sons who are now grown with their own families. She lives in Oregon with her supportive husband, Bernie, and their puppy, Mila. Cute. And I think I am familiar with Mila because I'm sure I've heard her a few times in the background when I've been conversing with you or Bernie, and she's a part of your life.
Vocal.
Yeah.
Right. She brings a lot of joy.
Oh, yeah. That's so sweet. That makes me miss my puppy, Max.
Oh, I'm sorry.
Yeah.
That's hard.
Well, let's officially welcome you. Hello, Carrie. Thank you for joining us.
Oh, Jocelyn, thank you so much for having me. I'm looking forward to telling my story and to share with you and your viewers about this very difficult situation.
All right. Well, let's just kind of get into it then. Now, you have presented before at like Arizona State University with the other members of the Alliance. They presented more of the scientific evidence part of this, and yours was more of the personal story. Although you are, a medical professional, you really kind of helped to shed that personal light on this problem because you are a survivor yourself, and it was Xanax that you were prescribed. Is that correct originally?
Actually, two benzodiazepines, Xanax and Valium. So I got to taper off of two.
Yay! So can you tell us, like, how did you end up being on a benzodiazepine?
Well, it was prescribed to me for pain. I was having a great deal of back pain, and I lived a very active life. We lived on a farm, and I was, digging holes and planting and landscaping and hauling, bags of this and that. And so my back was pretty sore. And so but I also was having arrhythmias, cardiac arrhythmias. So I went to my doctor and he said, I think you're anxious, and here's a prescription for Xanax, and you can take this for pain and for anxiety. So I did. And I used it very sparingly, because I was aware of the dependency issues with it. I hadn't seen it myself in my own practice, but I had heard of this. And so I was very careful and just took it now and then. And I eventually went back to my physician because the cardiac arrhythmia was getting worse. And I was actually diagnosed with a very common cardiac arrhythmia called atrial fibrillation and was treated for that, but still continued to use the Xanax intermittently for the anxiety that comes with a heart rate of 240 beats per minute. So I didn't realize what I was getting myself into because I thought I was safe using it so intermittently.
Yeah, and there's two things about your story that just bing, bing, bing when I hear it, right? So the first one is giving Xanax for pain because you know that benzodiazepines are terrible for pain. They're a terrible option for pain management, right? But unfortunately, it seems like they're being more commonly prescribed for pain because doctors are so scared to prescribe opiates now, basically. So now it's like, we're jumping out of the frying pan and into the fire. Oh, we'll prescribe you Xanax for pain. And then the other thing too that just strikes me right off the bat is you're a woman, you go in, you're like, hey, I'm having this problem and it's my heart. And the doctor's like, it's anxiety. Right? I mean, it's like,
yes.
Could it possibly be my heart, right?
Well, that's that made me very aware of that, Jocelyn, in retrospect, that often women are disregarded when they seek evaluation for what they believe is a serious condition, that it's thought that we are just hormonal and emotional, it taught me to be my own advocate much more strongly. So yeah, it was a very poor choice, and I think for prescription, the writer, and for me to take it, but I was not as informed as I am now. Now I would run the other way, but
Right.
then.
Wouldn't we all?
Yeah, exactly. I know so much more now. So yeah. So I continued to take this, and it was a few years later. And again, when I say intermittent, I mean very intermittent, maybe just a few times a month, and sometimes a few times a week. But it was not often. And this is my word of caution to everybody, because I think we think we're safe when we use it intermittently, but you're not. You're not.
Yeah. And honestly, I've made the mistake of perpetuating that. Like, well, I mean, normally if you don't take it every day, you're pretty safe. And
yeah,
I mean, generally, kind of, yeah, but it's not foolproof.
No, it's not. And unfortunately, we don't know who's going to suffer a benzodiazepine injury. I've heard you say this, and I've heard many of the professionals say this too, that anybody could be at risk for this. And so I think it's better safe to avoid it altogether, or maybe one-time use for an extreme panic disorder, or maybe a medical procedure. But this drug has the potential of causing great harm, and we need to be very careful about using it. So intermittent use then turned into just a variety of physical symptoms, physical and emotional symptoms. I started having more pain, more body pain, and it was kind of systemic body pain, particularly in my pelvis. And I was waking with tremendous anxiety. I was having just exaggerated anxiety to just really normal, everyday situations, and feeling miserable. I just was not feeling well at all. And everything else in my life was going pretty well. So it's not that, I was ill from something else, or I was living under a great deal of stress. I really wasn't. It's just my body was not doing well. And I went back to my doctor, who suggested things like stress reduction, which I did. I implemented those. I took a mindfulness-based stress reduction class. I started doing more yoga. He said, you need to walk more. I walked more. I walked my dog. I did all kinds of things. I had a very cleaned up diet. I don't drink alcohol, so I wasn't drinking, or I was doing everything I possibly could. And
yeah, I mean, you were like the perfect patient, basically.
Well, I kind of was. I wanted to get well. I was very motivated to get well. I mean, this was interfering with my life tremendously. I was having trouble working because I felt so poorly, and it was affecting our marriage. I mean, I couldn't participate fully. And my physician then suggested that perhaps I should go on the benzodiazepine full time, because the morning anxiety was so poor. And so I did. And guess what? I got a little better, because I realize now in retrospect that I was in interdose withdrawal. And once I went on it full time, it satisfied that need for the drug dependency, and I started feeling a little better. But it was only a few weeks later that I really got ill. It was as if I had developed an intolerance to the drug, and I got very, very sick very quickly. And at that point, I started researching, and I knew then that I had developed a drug dependency, and then probably an intolerance to taking the Xanax. So
kind of like, are you thinking it was that you were intolerant? Do you know that, like, the term tolerance, there's tolerance withdrawal, And then there's
Uh-huh.
going paradoxical.
I don't really know, but I would imagine you could call it a paradoxical response, because in just a matter of weeks, I developed suicidal ideation and severe depression and the anxiety that was 24/7, more body pain. It was quite dramatic. And went from being,
Well, it's sorry to throw that term out to you because if you're
yeah,
not familiar with it. So like because a lot of people I think they've gone paradoxical when they get really bad on it. But paradoxical is like when you take it and the moment you kind of take it, you get worse after taking it.
well, that would describe me then. Yes. Yeah. And so I really committed myself to finding out what was going on. And I went to my physician and explained what was going on. And really, she didn't, I had changed physicians, and she didn't understand this at all. In fact, it encouraged me that it wasn't the drug that was causing these symptoms, that she couldn't help me unless I took the drugs. And I knew then that I had to find someone else, because after reading the Ashton manual and some of the other research that I found online, I was well convinced that it was the benzodiazepine that was making me ill. And at that point, I was also taking the Valium for the pelvic spasms. Mm-hmm. So I had 2 benzodiazepines on board. I was very, very ill, and I had no support from my physician around these symptoms, other than wanting me to take more of the drugs and add drugs to it.
Right.
So, yeah. So,
did the Valium help at all?
Did the Valium help? Is that what you asked?
Mm-hmm.
Well, at first it did. It helped relax. The idea of the Valium, and it was not by mouth Valium. It was intravaginally, and it was compounded. Yeah, right. And since then I've met a number of women who were prescribed this to use intravaginally for the treatment of pelvic spasms and even rectal spasms.
Wow.
And it was compounded by my pharmacist. And so I very quickly developed a nice relation with my pharmacist, who understood about benzodiazepine withdrawal syndrome. So once I started investigating, once I knew what was going on, and that was a relief to find the information online that validated this crazy combination of symptoms I was having, from mental health symptoms to physical symptoms, that really rendered me very, very ill and disabled. Once I found that information, I kind of felt empowered, that I knew that I just had to get off the drug, and I actually thought it would be quite simple. A few weeks of tapering and I'll be okay. Yeah. Well, it turned into 38 months of tapering off a relatively small amount of Xanax and Valium. So over 3 years of tapering, and I did a wide variety. I remember one day watching one of your videos, Jocelyn, about tapering and your water taper, in fact. And so I tried cut and hold. First of all, I decided to taper the short-acting benzodiazepine first. Mm-hmm. And so I tackled the Xanax, and I started cutting and holding, and the anxiety was just so difficult doing such large cuts, because it was hard to cut a small amount by cutting the tablet. So I went from cut and hold to crushing the tablet, and then in spreading it out on graph paper and taking away a really tiny little piece of it. I mean, I was my own chemist, right? I mean,
yeah, you look like you're doing something illegal, no matter
absolutely.
You look like you're doing something wrong when you're tapering your own benzodiazepine.
Right. Especially when you're, I'm in the safety of my own kitchen, it was okay. But when we traveled and I went, to a hotel room doing this, somehow it just didn't feel quite right. But so I went from cut and hold to crush and divide to a water taper. And that's how I got off of the Xanax. So 0.75 Xanax in 18 months. And then I started on the Valium. And I did that very slowly. I would pack a TB syringe with the cream, and then very slowly, by just a tiny little bit, a fraction of a dose reduction on a daily or weekly basis. And it took me another year plus to get rid of that. Right. And so during that time of the taper, because my own physician was unavailable to me, I had to develop a new circle of medical providers. And so I started looking, and I found a naturopath who was a mental health naturopath who knew about this. In fact, she put me in contact with some of her patients who were also tapering and having a difficult time. And we had our own little support group, at a local grocery store coffee shop, where we would sit together and talk about what we were doing and how we were coping.
A lot of people are missing that. And that's like, you had so many issues, and honestly, we kind of glossed over how bad you were. You were so bad during withdrawal. This was anxiety or some pelvic pain.
I'll dip back into that.
Go ahead, and then we'll. Yeah.
Well, so I want to address that, and it's easy now to kind of not want to go to that place because it was so difficult.
Yeah, and it's triggering for me. Like, people ask me, what symptoms do you have? And I'll try and address them in a video, but I don't want to be rehashing this all the time because it is so traumatic. It is. And, part of my coping mechanism during that time was to minimize the symptoms. Because I same here. I didn't focus on them. I didn't say, I have this, and I didn't do that because it was too much.
That was a trigger in itself for me to list everything and to really be honest about how bad I felt. Mm-hmm. And so I found that it was easier if I kind of acted my way through my day. And but you're right, I was quite ill, and my goal through the taper was to be as functional as I possibly could. I had quit working. I could no longer work because I couldn't safely practice nursing. I was too ill. I couldn't make clinical judgments being as compromised as I was. Mm-hmm. So I feel very fortunate in that I could be home, and I had a supportive partner. Once Bernie read some of the research, he was 100% on board. And again, I'm very fortunate for that because many people are doing this without a supportive partner. I know Paul has been very supportive for you, and it's just a wonderful cushion. It's a cushion. But I minimized my symptoms just as a coping mechanism, but I was very ill. There was months that I didn't really go far from bed, couch, and bathroom. And this was very different for me. I'm a very independent and active and engaged woman, and this was nowhere near who I was. And but I was unable to do anything more. Taking a shower was exhausting, and I would go 5-6 days without showering just because I was so tired, and the shower was frightening, and the water hurt my skin, and it was very, very challenging.
Yeah.
And
to all of that, showers are brutal. Showers are a brutal thing to go through during something so
right. And I understood that the hypersensitivity to tactile stimulation, like clothing. I wore loose yoga clothes for years because that's all I could stand on my skin. Putting on an underwire bra was painful, and wearing underpants with seams, all of that was really challenging. My husband understood that, but there were really few people in my circle that got it, that understood just how challenging this was. And it was very isolating as well. And
yeah, it is. And I don't know about you, but for me, I didn't even know how to begin to explain it to people at the
no,
time. Because
how
not
do
only are
you
you suffering
explain?
so much physically, right? And it's
Yeah,
so crazy in the first place.
yeah.
But then, like, cognitively, I mean, I can't even imagine attempting to be a nurse during this. You know, just attempting to be a mother during this was way beyond my capacity. Just,
Oh,
you know,
oh, my heart goes out to you, mamas of young kids doing this. Our first granddaughter was born during this
uh,
experience, and that was my line of work. I was a maternal child nurse, and I had had my own babies, and really value the place of a woman in their children's lives. And I remember looking at Kala and thinking, what do I do with this baby? I was completely overwhelmed.
yeah.
It's like I didn't know I was what to do. I was having trouble connecting with this new little being
Yeah,
and
'cause
with other
you don't
people.
feel love, which is the craziest thing, right? You don't
It's
even
the
know.
cruelest.
It is so cruel. It is so cruel. Like I would sit there with my kids and be like, I don't feel anything for this child that I brought into the world,
Oh,
other than like
it's,
shame or guilt or something. It's so
yeah, yeah. That's another piece of it, because when you are feeling this way, um, there is a lot of guilt, and there's a lot of shame around being so void of emotion, and that's a very difficult thing to explain to people. And so there's the term benzo loneliness that we hear so much in the community, and it's so very true. You just feel so isolated, and are sometimes, quite frankly, hesitant to explain your symptoms to someone because they sound so crazy. And
bizarre. I mean, even
yeah,
saying you're suicidal, it's like you don't want to tell people that because you don't want
yeah,
them taking you to the emergency
yeah.
room or whatever. It's like, because
Oh,
there's something inside you that knows this isn't coming from me. Like, this
right,
isn't me. It's just,
right.
it's what I call the benzo beast. It's the benzo beast raging, inside of you, telling you to do these things or these things, but it's not you, and you're probably not going to act on it. It's just so scary when it.
It, yeah, it is very scary. There was a time, and this was during the taper, that my husband traveled quite a bit, and I had to ask him not to travel because I was afraid to be left alone. I didn't trust myself, and gratefully, that didn't last much more than, I can't even remember how long, but it was significant enough that he had to alter his schedule to be at home with me. And so it was bad. I really suffered during my taper. The taper was very difficult, but I was able to get to a point, kind of what I called the taper rhythm, that I was able to be functional enough to to take care of myself. That was kind of a goal. I didn't want my husband to have to shower me and help me with those, the hygiene pieces. I wanted to be able to do that myself. And so I got to that point that I could care for myself. I could drive locally again. It took me a long time to be able to drive on the freeway again. And I was very devoted to self-care and developed this new circle of healthcare professionals that were quite supportive of me. And none of them were benzo experts when I got involved with them at all, but they were willing to listen, and they were not threatened at all by me coming in with some new ideas and asking for their help. And I know that can be a challenging thing to find when you're looking for support coming off of benzodiazepines. But I felt very fortunate to develop this team. And it was a multidisciplinary team too. I had a naturopath, an acupuncturist, a massage therapist, a therapist, and it changed over time as my needs changed. But I found that that level of care was really critical in getting me through that. And so
I also
all
did
of them,
acupuncture regularly. I did
yeah.
acupuncture regularly, and then
Uh-huh.
my dad is actually a chiropractor, although chiropractic
Um,
he was a little too much.
mhm.
I only did it if I absolutely had to, because and this may have been both from the benzodiazepines and the fluoroquinolones, but I would have things that would just go out of joint, just all of a sudden something would just go, and it was so
Yeah,
and
yeah.
so I'd have to go to my dad and have him reset it or put it back in. But yeah, I tried. I also tried to find a good therapist. I couldn't find any doctors that really understood it. I had a doctor that I had a good relationship with, because he'd
Uh-huh.
known me before, and so he was willing to do it with me. But at the end of the day, he wasn't really willing to consider that this is the way that you taper other people too. You know, that maybe this is something he should implement in his practice. But yeah, a therapist. I tried to find a good therapist, but honestly, for me, it was exhausting just trying to explain this again and again to people. I just couldn't.
Oh,
Like, I think
yeah.
I went through that twice. And I was like, you know what? I don't have the energy for this. It's not worth it. So
Yes. No, you only have so much to give, right? And when you have a family to care for and yourself to care for, trying to explain this again is exhausting. And so even a team of one and is good, as long as I think it's important for you to cultivate a relationship with some supportive professional that's going to see you through your taper, because we are dependent on the prescriptive practice of our physician, and that's a scary thing. It's a threat that you could be dropped from their practice, or
oh yeah,
lose your resource. And
that's a
oh
common
gosh, it
fear.
sounds crazy, but
Yeah,
it's very true.
it's I saw all the time online, so I was
Yeah,
constantly afraid of that. And then my doctor
yeah.
got flagged by the DEA for overprescribing. Like, oh crap,
No.
No, I mean, because I've been to other doctors, and that I knew that they were not going to be cool with prescribing me my Valium, even though I was getting off of it. So,
Yeah,
but I'm so
yeah,
glad to hear too that you had like a peer support network.
yeah,
Yeah, because
yeah.
that's crucial. A lot of people are missing that. I mean, there are support groups online, but they can be really tricky to navigate. I was
Right.
lucky enough that I had a couple good friends at the beginning that I met kind of right off the bat in a group. I had a good group at the time, and then there was just a few of us who got together who were all kind of similar. We'd all been on short term, or like a small low dose or short term, and we were all moms, and so we all just kind of related.
You click.
Yeah, you click, and so I mean, I don't know how I would have gotten through all this if I didn't have these people there.
Oh, Jocelyn. So true. I had the little local support group, but through my doctor, but my little local group grew through one of the online communities when we found out we were both from Portland, and then we exchanged a little more information. And I find this kind of interesting, really. One of my very best friends that I met through the online community, and I communicate very often, but we've never met.
Yeah. Yeah.
And yet I consider her one of my closest friends. And so I'll say good night from across the river, and she'll say good night from across the river. And so having a group of people, or just even one friend that knows what you're going through, is so important. So I had a number of people like this. I have one of my dear friends that I met online. It lives down in California, in Palm Springs, and he and I just communicated this morning. We're almost 5 years off of this drug, and we still connect with one another. And then I have a friend who wasn't even in the community, one of my dear girlfriends, who has contacted me every day through this journey. She has not missed one day that she hasn't called or texted me, and I am so grateful for her friendship. She didn't leave when the going got tough. She stayed, and even when she didn't get it, she was there. And I feel so fortunate. So hold on to a friend like that, because it's very important that you have someone to lean on when you really need it. And so
Yeah,
it was.
I mean, I had Paul, obviously, and sometimes I think it was hard for him to really understand or believe everything, but he was very supportive, and but it was really hard for me locally. I had some really great people at church who were very kind, who
Lovely.
come over and visit and things like that. But then it was really hard sometimes with extended family or just with the friends who I had before who did know me to try and believe or understand or just wrap their heads around what was going on, and
Right.
yeah, it's both. I mean, I had both good and bad. It wasn't all pleasant sometimes, the experiences that I had, but
Not. I think one of the hardest things, Jocelyn, is when people don't take the time to learn what's going on with you, or are kind of grow tired of your journey, because this isn't a 2-week course of feeling crummy and then being able to re-engage again. I mean, this
right.
goes on for years.
Quite frankly, this isn't like 9 months of chemo, even.
No.
This is like
yeah.
1, 2, 3 years,
Right. Right.
For some
And
people.
right. I've heard some cancer survivors say that this was more challenging to them than their cancer experience. And I mean, I'm sure I'm fortunate not to have had experienced that. But there are a lot of losses associated with this, those friendships that don't survive this. And I think that's part of our learning through this, is that sometimes we just have to move on and take care of ourselves. And maybe there will be a time that those relationships can be rekindled. I don't know, but it's been a sad thing for me, but I feel like new things have come into my circle because of this experience, and that are very fulfilling. So
yeah, and part of that is the alliance, of course, and being able for me to reach out and help people. And so there is, I think you and I would both agree, there is that balance kind of to life, in a sense. When you go through something that's awful, there are ways that that good can come from it, if you let it.
Well, I really want to believe that, Jocelyn, and I think you're a very good example of that. You, even on days you don't feel well, you are working to educate people and to support people through this experience. And I knew at one point during this that if I survived it, that I was going to spend some time being an advocate in this community. And I feel my nursing background has been very helpful. When it was I had very good training to be able to step back from my own personal struggle and assess it clinically. I mean, I was able to separate myself often from the symptoms and say, that is directly related to the drug damage. That is not me. And I found that to be very, very helpful. And I wanted to bring that up. Maybe it didn't fit in here, but I wanted to say that.
I think because honestly, one of the most frequent questions I get from people is could this really be related to the benzo? Is this really from the benzo? And it's like, no, yeah, it really is. I know it seems impossible. It seems kind of crazy. And hopefully I'll get into some more of the technical aspects of that in later interviews with some of the other, research doctors, the alliance. But when you understand how this works, it really is possible. This kind of an injury can do like an unlimited amount of damage, in a sense. It's calculable how many cells in your body are actually affected by this.
I don't think there are any cells that aren't affected by this. And if you think of your central nervous system as the kind of the command center, and that your central nervous system seems to be very heavily affected by benzodiazepines, of course, every aspect of our life is touched by this. And so I think it's very beneficial to be able to kind of step back and say, all of this that I'm feeling is a result of the damage. I used to say to Bernie, I'm still here.
Yeah.
I'm still here. I feel like I'm lost, but I'm still here.
Yeah.
And I want to share this little dream I had. It was during my taper, and I had this dream that I was laying under the surface of a lake and floating just like 4 to 6 inches underneath the surface of the lake. And I could see myself floating, and I remember saying, I'm still here. I'm waiting. I'm still here. And it's very true. So I don't want anyone ever to lose sight that you're not there underneath all of these symptoms. Those symptoms are not you. Those symptoms are the damage caused by this class of medication. And in time, you will heal from it.
Right.
And there are a lot of things we can do to help support ourselves through this. I have yet to be fully convinced that any of these interventions are really contributing to moving this along any faster. I think that sometimes it's just is what it is, and that it takes time to heal, and that all of the things we do, like healthy diet and exercise and good sleep hygiene and avoiding stress, are supporting our bodies in other wonderful ways. But I don't really know if they're helping to facilitate neural healing, but they are very nurturing, even if they are not. And so for us to get on a regime of, again, what I call devoted self-care, just to really make yourself a priority and exercise yourself well, feed yourself well, avoid stress, love well. When you start feeling that ability to love again is just so wonderful. And don't ever let that keep you. When you're in that phase of not being able to feel that, know that will return. When I did a little prep work with you yesterday, Jocelyn, I said, I'm a little hesitant to say that I'll be 5 years off in July and that I'm still somewhat symptomatic. And you reassured me that it's important for people to hear that. And that it's not, I am nowhere near what I was year
Obviously.
1,
I mean,
2, and
because
3.
you wouldn't be sitting here in front of a camera
Oh.
with your makeup done, having
no.
a conversation if you were as bad as you were.
No, the joke in my household is that I've worn out the couch, because honestly, it's a velvet couch and it has like, the nap is worn on it from all the miles I logged on that couch, because that was all I was able to do. And gratefully now, I got up this morning, I went grocery shopping, I have a pot of soup on the stove, I'll do some yoga when you and I are finished with this today. And I'm actually a little more symptomatic than I usually am. I have an orthopedic issue right now with a bad hip. And I think this is worth mentioning because the pain from the hip exaggerates some of the residual benzodiazepine symptoms that I have. And I'm finding myself more anxious, and I have less tolerance for just stimulation, and it feels like a few steps back. But I also know that once I get this hip taken care of, that I'll probably be feeling better once that level of pain is addressed. So
That's part of the frustration and the hope that comes with healing, because you do get better, and like you said, you're still under. I love that imagery of your dream because, I just love it. But also, it's very similar to some imagery that I use in my book. It's just the idea of being underwater and the idea that you're still under there, right? It's buried under all of this rubble of pain, right. and I was trauma and torment, but underneath all of that, you really are still there, even though it doesn't seem like it, even though you almost forget who you are. When all stuff is lifted off and heals, you come back to life. It is a rebirth. Yeah.
That is so true. And that I think if there's a message that I want conveyed today, it's that very one. It is that you are not lost.
Yeah.
You are temporarily damaged by this medication, and that you will be better. And so your task is to remind yourself on a daily basis that one day this will resolve.
Mm-hmm.
And I'm not where I would like to be yet.
Neither am I. Yeah.
But I am so much better. We have a new grandbaby that was just born 5 weeks ago, and we're going down to see her tomorrow. She lives in another town just about 2 hours from here. And all of you who are sufferers will understand, I'm actually excited about going to see her. And that brings tears to my eyes, because that is what life is about, is to be able to be joyful when beautiful things happen in your life. There was a time that I could not find that joy. I could not feel it. And it's not for the lack of trying. And please, I want people to know that too. We can't try to feel a way that our body is incapable of feeling. We don't have the right chemistry during this time, or the right physiology. I think chemistry and physiology is both off. We don't have that in place to feel joy, to feel love, to feel well. Right. And that with healing.
Carrie, the irony of this is that you do have good windows, right? So you could be so bad. I don't know how many, if you had any, but I would have good windows. And then,
yeah.
And so then it kind of looks like, oh, it's mind over matter. When she really wants to try, she can be better. And so that almost made my predicament worse as far as in relationships or whatever, because it's like, oh, she's just kind of picking and choosing when she really wants to try. And it's like, no, it's just my body, for whatever reason, is kind of online today, and the next day it's not, or that next hour or half hour. So it's kind of an ironic illness at the same time. But did you get good windows, or as you were off, did you have the good windows back?
No. No. And I have to say, I would always be a little envious of people who had windows, but I can't say I didn't have I think sometimes people think a window is like a wide open, clear window.
No, you're not 100%.
Yeah, sometimes it's just feeling a little better. And I had times I felt a little better. Usually in the evenings, I felt a little bit better.
Yes.
And that was grateful. Not great. I mean, but I felt well enough to walk down the hall and get something to eat or something. Yeah. But I had very few times that I felt like it was a real window. Oh. And I don't know if that's a disadvantage or an advantage, because when I think of you having these beautiful windows, or other of our friends or and members of the community, and then having to go back into feeling, miserable, that's got to be really hard. But I am getting, I don't ever feel 100% well, but I'm getting more vigor and more enthusiasm and more hope as time goes on. And I think all of us kind of hold our anniversary in our minds. I'm looking, this next week will be how many, 4 years, 8 months, I think, or maybe 9 months. And so this is a big deal for me coming up here in July, being 5 years off. So I feel like I need to do something really special and celebrate that, and to celebrate my tenacity and resilience and ability for this, this beautiful body to heal. And I'm just so grateful to be here, because there were many, many months and even a few years that I felt like I wasn't going to survive this, but I did. Right. I did. And you will too. Everybody will, as long as we let time pass and care for ourselves well.
Yeah. And quite frankly, I don't know, people get mad at me for saying this sometimes, but don't complicate it by adding in a bunch of other drugs. And I get that, that they do help some people to minimize sometimes the the symptoms, but more often than not, and again, I'm seeing the worst of the worst, so I know my perspective is a little skewed, but more often than not, the people who do not survive this are the people who are polydrugged. They are the people who were just following their doctor's advice. Their doctors didn't know what to do, so they put them on multiple psychiatric drugs.
Right.
And they either end up taking their lives because their minds just cannot cope with all of that neurotoxicity and the pain and everything else.
Yeah.
Or they just die, or unfortunately, like maybe a stroke, or I don't even know what. I think maybe people's hearts give out. We don't even really know. But otherwise, honestly, it's almost unfortunate. You feel sometimes that you can't die from it. Like you're like, kind of wish I could. Like again, the irony of this is you actually don't die from this. No, you can suffer so much and still not die, and you're gonna make it through, and then you are gonna get through.
Oh my gosh, I used to say to Bernie, I feel like I'm rotting from the inside out. I mean, I just felt so sick and irreparable. But slowly it happens. And one of the words I heard a lot, I mean, I feel very lucky in that the work through the Alliance for Benzodiazepine Best Practices put me in contact with so many survivors. And I've had the chance to talk to a lot of people. And a word I hear often is glacial healing. Like it just takes a glacial amount of time for this to get better.
Yeah.
And I think that's very true. And for us to go into this with the knowledge that maybe I'll heal very quickly from this, and I'm going to do everything I can do to help facilitate that, but maybe I won't. And that took a little wrestling for me, because I tapered very slowly. I tapered responsibly. I took very good care of myself, and still, I had the illusion that I might be well once I tapered off, because I had done it so slowly. And
me too.
Whoops.
Me too.
Yes. That was a hard reality, wasn't it?
I don't know that I ever latched on to that reality. It took me so long before I realized, oh wait, maybe I'm not going to be one of these people who goes back to work, or is just out and living life the way that they used to live it. I kept waiting for that time where I could go back to my old life. And it took me a long time to recognize that, okay, I need to be grateful for the healing that I do have, and stop trying to get back to the person I used to be, because that's just probably never going to happen. I mean, and again, I don't want to discourage people, because life is good. I'm living a good life. I'm super lucky because I don't have to work, and because some days I could hold down a job, and other days I definitely could not.
Yeah.
So it's, I have my good times and my bad times, and I'm just learning to, accept the life that I have, in the fact that I have an injury. Like other people get in car accidents, or other people have autoimmune illnesses or whatever. I have this injury, and it is what it is for now. But that's not to say that I don't believe I'll still heal, because I believe I will. I am still healing. So I don't know where I'm in 5 years. Yeah.
And Jocelyn, that's such a healthy perspective. I think if we keep waiting around until we are all better, that may not come. But I do believe, just looking at our course of healing so far, that you are so much better than you were a year or 2 or 3 years ago, that the potential for healing more is very, very real. So to believe in that, but to also not let it limit you. That and I know sometimes it's just not possible to travel, or to to resume work, and you are working. You may not be working outside of your home, but you certainly are working a lot.
Yeah. No, I'm working hard.
And yes, you are. I know that about you. And And so you are certainly demonstrating the signs of a healthy neurological system, but you are still living with limitations. And I think just making peace with that and understanding that, yeah, maybe I'm not going to be the woman I was before, but I can still live my life, and I can still find joy in my everyday being, and be grateful for that. I mean, things are changed. We've had a neurological injury from this drug, and what is that going to look like for us? We don't really know, but if we can find some peace along the way, I think that is a very valuable coping skill.
Yeah. Is there anything else that you would want to share, or that you were thinking of before we got together today, that you would just like to tell people that you've learned from your experience, or to help them do this, or friends and family?
Well, oh gosh, I could talk for days about this, and someday maybe you and I will, Jocelyn, when we have the good fortune to be together again. But I want people to remain hopeful. And again, that's hard sometimes when you don't have the right physiology and chemistry to feel that way. But just to know that you will get better, and that over time that your life will start feeling worth living again, and to please not to do anything permanent that would alter your chances of engaging in life in a meaningful way. That this is probably one of the hardest things that many of us will ever do, and to know that you have the strength in you to get through this. I did not know how strong and resilient I was until this came into my life. And it came into my life at a much later time. I was in my 50s when this happened, and I thought I had been through a lot of challenges, but nothing compares to this. And I know now that I can do anything after surviving and managing this injury that my husband used to tease me for being so stubborn, and I tell him it's a good thing I am, or I wouldn't have survived this. But I think we are so much stronger and so much more resilient than we know, and to call on that strength even in moments that you don't know that it's there, because it is there, and you're still there. It's just a matter of time before you emerge again and really feel feel your life again in a positive way.
Yeah, that's so very true. I love how when I do speak to survivors like yourself, we all really learn the same truths in going through this. There's a lot of understanding and enlightenment, I would say, when you really are able to take a step back and work through this and learn what you can learn from it. It's so true on so many levels. Like you said, we go on for days, but we've gone on for quite a while here. So we will wrap this up. It's been.
Thank you so much.
Oh yeah, no, I'm so glad I got a chance to talk with you. And again, I feel like this is a conversation that people are really going to benefit from. They're gonna see themselves in you, and the fact that you were a nurse, you were a research nurse, you even knew how to look this stuff up, and you knew doctors, and it can happen to anybody.
It can happen to anybody, and it's no fault of yours. Please know that. It's no fault. Yeah, there's no shame around this. There's no fault. It just happens. So.
And we just heal through no fault of our own too.
Right. Exactly.
About it.
Right. That's right. I just so appreciate the opportunity to speak with you, and I'm happy to do so again sometime if you'd like to broach another topic. we've been in the trenches together, and I hope that my words have been comforting to somebody today. And if you'd like to, you can always contact us through the Alliance for Benzodiazepine Best Practices.
All right. Well, thank you so much, Carrie. And
Thank you, Jocelyn.
give your doggy a snuggle for me. And
I will. I'm going to go out and throw the ball for her a little bit now. So
okay.
Thank you so much, dear, for all the work you do. I appreciate you. Okay.
I appreciate you too. Thanks, Carrie.
Okay. Bye-bye.
Bye.